Pathophysiology of angina pectoris. Pathophysiology of angina pectoris. Okay, so angina pectoris is a disease condition that you're having a lot of chest pains, and this is as a result of what? You know, the artery, the coronary artery should be as wide as this, but normally, okay, but now there's like accumulation of fat on the walls. So as fat is accumulating on the walls, the space in which blood should pass is becoming very small. Alright. So the pathophysiology is more of like we are trying to discuss the disease, we are trying to state what causes it, they're trying to look at how the disease actually progress to the very stage that we are. Okay. So I saying that angina pectoris is actually what? A type of chest pain caused by reduced blood flow to the heart. And this reduced blood flow is due to what? A narrowing of the coronary artery. So you are feeling some chest pain, but it's actually is the heart that is lying underneath the chest that has the problem. Okay. So angina is actually a symptom of coronary artery disease, right? Angina pain feels like squeezing, pressure, heaviness, or tightness, or pain in the chest, right? It can be sudden and reoccur over time. Sometimes the patient will have an angina episode, that's what they call it. You have an angina episode, you scream, you shout, whoa, then later you're fine. Okay, so it can be sudden, it will go away, it will reoccur again. All right. Angina pectoris is a disease condition that actually results from what? Myocardial ischemia. When they say myocardial ischemia, they're simply saying the heart muscles, myo of the cardium. Myo is muscle, cardium is heart. So that means heart muscles are not receiving enough oxygen that they should. Alright, so you're having an ischemia. Alright, so it actually results from what? Myocardial ischemia caused by what? Imbalance between myocardial oxygen demand and myocardial oxygen supply. So the heart muscles, the demand or the amount of oxygen they need is becoming more than the amount of oxygen that is being supplied. Okay, so that's why you're having myocardial ischemia. That's why you're having what? Yeah, myocardial ischemia resulting to what? Angina pectoris. So this myocardial oxygen demand is determined by what? How fast the heart is beating. That's heart rate. How high your blood pressure is. Is also determined on the left ventricle. How stressed the left ventricle is. Okay. There is also determined by how fast the left ventricle is contracting, because the left ventricle is a part of the heart that actually pumps blood into systemic supply. So the heart, if the left ventricle is now pumping blood very slowly, very sluggish, it won't be able to meet up with the oxygen demand. Okay. They also look at what? Aortic stenosis. Is there a block in the aorta? Right? Or determined. So this myocardial oxygen supply is determined. We have spoken about the demand, things that will cause the oxygen demand to now go up. For the oxygen supply, is determined by what? Coronary artery blood flow, then coronary arterial oxygen content. Okay, so I think this is just basically the pathophysiology. You talking about things that actually cause this problem. All right. So I think that's it for the pathophysiology of angina pectoris. See you guys.